High cholesterol is known as a silent killer as there are no obvious symptoms. But in some cases, people with high cholesterol may also develop small skin-colored lumps around the corners of the eyelids, known as Xanthelasma. While they aren't harmful, the skin condition shouldn't be ignored and should be checked out by doctors. The condition is caused by a collection of yellowish cholesterol deposits underneath the skin around the eyes. It is rare, but it is an indicator of high levels of cholesterol or other fats in the blood. But experts said it is also possible to get it even if cholesterol levels are normal. Dr. Seth Rankin, a senior NHS GP and founder of London Doctors Clinic said, "It's thought that Mona Lisa may have fallen victim to cholesterol, with eagle-eyed medics pointing out what looks like xanthelasma around her eyes." However, he added that in most cases, unless people have had a blood test or sport these warning spots, it is hard to spot high cholesterol. He said, "Cholesterol is a type of fat made naturally in the body which is transported through our blood. High levels of cholesterol can create a buildup of plaque in the arteries which can block the flow of blood and increase your risk of heart attacks, strokes and aneurysms. You don't even necessarily have to be overweight or obese to develop high cholesterol. The only requirement is bad genes or a diet high in saturated fats, so adults and young children are both at risk." High cholesterol causes the narrowing of the arteries, atherosclerosis, heart attack, stroke and peripheral arterial disease. Dr. Rankin said the best way to lower cholesterol is to keep an eye on diet and avoid eating animal-based saturated fats and cholesterol. However, he said it is not enough for many people whose genes are against them. He added, "With no stepping stones between healthy cholesterol and high, many doctors recommend getting your cholesterol levels tested properly at least every 5 years, particularly if you are considered high risk. This can be done with a simple blood test. Basic cholesterol screens will measure just the total cholesterol level, which gives a general overview of your cholesterol situation. A total cholesterol level below 5 millimoles/L is optimum, although it's thought that over 60% of the UK population have scores higher than this, putting themselves at risk of cardiovascular diseases." He said during more thorough screening, doctors will then investigate the levels of both good and bad cholesterol levels separately. He added, "The bad cholesterol, LDL, level should be 3 or less in a healthy adult. Since this is the harmful artery-clogging cholesterol, the lower the better. High-risk patients, those who smoke, are obese, have high blood pressure, or are diabetic, are advised to aim for a LDL level of 2 or less." However, he added levels for the good cholesterol, HDL, should be at least 1.2, the higher the better. If all else fails, and you're struggling to maintain safe cholesterol levels with diet and exercise alone, speak to your GP and see what the options are, he added. Patients with high cholesterol can also be prescribed statins. Watch more videos at video.5la.net.